Oh, I think life extension is of critical importance to patients. It's the first question patients ask you when they've heard the bad news that they have sadly what is for most an incurable disease and a diagnosis of a limited life expectancy. They want to know, well, how long am I likely to live? And indeed, one of the very satisfying things about treating the very difficult and sad disease, which is metastatic breast cancer, is that we have done so much better over the last several decades in terms of extending the life expectancy of patients who have secondary or metastatic breast cancer. And I guess one of the real gratifying things about this, and it's a sad story to have to tell, but when we lose a patient with metastatic breast cancer, and when patients write to you to thank you, the one thing they repeatedly say is, "Thank you, doctor, for keeping her alive long enough to see our children graduate from college or our daughter get married or to see her first grandchild." You hear that so often. Being alive quality of life is important, don't get me wrong, but being alive is very important to these patients. I think it is the ultimate therapy goal. I think it is the ultimate endpoint for trials. And the fact that so many trials don't use overall survival as an endpoint is not because it's not important, but because it's so hard. Because so many patients who get any particular line of treatment for metastatic breast cancer may, when that treatment fails them, still have another treatment option left to them, which may make them live somewhat longer. So for that reason, it's a hard endpoint, and many drugs which are in routine use in the treatment of breast cancer were approved based on studies in which the endpoint was something less than overall survival, typically progression-free survival, or in some cases response rate. Well, I think doctors and patients really are on the same side, obviously. We all want the same thing for our patients. We want them to live as long as they can and as well as they can. So it's important to us to know that we have treatments which do make patients live longer. And indeed, it must be said that in the case of some drugs and medications which have become available for the treatment of some cancers, especially in ones where there's a toxicity issue, or I hate to say it from society's point of view, sometimes where there's an expense issue involved in the drug, there is a tendency on doctors to look critically on data which is not overall survival data and wonder exactly how much difference is it making. It's much easier to make a case to yourself and for the patient to accept the need or the advisability of taking a treatment if you can say something as cleanly to them as, "It is likely you will live longer as a result of this treatment." That is a much easier thing to explain to patients. It's a much easier thing for patients to understand. And more importantly, it's more important to them because it's important, and they know what's important for them. They actually understand the difference between being alive and not being alive. And that really is the acid test. Not only is it good medical science to use when you can, overall survival as an endpoint, but from the human point of view, it's very important to patients. I mean, one can get all philosophical about this. The first thing you learn is what an extraordinary privilege it is to look after these patients. It is, from a selfish professional point of view, it is a very gratifying relationship. These are a group of patients who have a desperate, desperate situation. They have probably, before they come to you in many cases, heard the worst news they're ever going to get in their entire life. And you come along and offer them, not false hope, but hope that, yes, we can achieve a degree of control of this, maybe a very good degree of control. In the case of some presentations of metastatic breast cancer, we can tell people, you've probably just heard that your cancer is incurable and things look very, very dark and very, 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 very pessimistic from here. But I could say to you, it is likely you're going to be alive for quite a few years. I can't promise you will be, but it's likely you will be alive for quite a few years with the various treatments we have available. And that often is hugely consoling to patients to hear that. From a personal level, I guess, you do really get to understand what's important about life. I guess, like all of us, maybe doctors always don't take the lessons on board as well as they should, but the truth of the matter is you do really understand how important family is and how important it is to try and be there for people.